Let's talk more about that weight loss piece because a lot of people, when they first come to the ketogenic diet, it is for weight loss. And we know you've touched on the fact that people with cancer can have a challenge keeping weight on, cachexia. So for somebody that adopts a ketogenic diet, and we can get into a lot of nuance around that, but we'll just keep it general. Talk about over time what happens to the weight, because if there's somebody that is overweight and they go on that diet, they're going to naturally come back to a baseline. But if somebody has cancer and that other element, how does that tend to play out? You've touched on it, but I want to get into the nuances here.
Yeah. When we're using a ketogenic diet, I call it a weight balancing diet because yes, if you are overweight, it will help you burn fat that you have on your body. When you are underweight, it actually helps you build lean mass. And so we know that there are body composition improvements in patients who follow ketogenic diets. Even in cancer patients, we've seen some of that with increase in lean mass, increased bone mineral density, increased overall mass. So some of our head and neck cancer patients or GI cancer patients that do have problems with weight maintenance, especially during therapies, we've seen on ketogenic diets that they can actually gain weight. So I will say that there are some times where patients need to really focus on getting in adequate calories, getting in adequate fast. Sometimes when you're going through chemotherapy, if you are suffering symptoms from that chemotherapy, a lot of times you just don't feel hungry. You feel nauseous or something where you're not eating. So we have to really utilize the days that we're feeling good to try to build back and build up. But one of the common mistakes when people start a ketogenic diet is they just do a low carb diet, meaning they just start cutting out carbs, but they're not actually eating any fat. They're eating chicken breasts and salmon, which great, fine. But then they're not adding enough fat. So now they don't have carbs and they don't have fat and they have no energy and they feel terrible and they're wasting away because they need to eat something. They need to get energy somewhere. So it is about education. It is about don't fear the fat. It is about choosing fattier cuts of meats and eating whole eggs, never egg whites and things like that, where we're really trying to optimize the fat that they're taking in, which is now going to replace typically a high carbohydrate diet. But not everybody is eating a high carbohydrate diet, but most are.
You touched on the fact that when somebody's going through treatment, they may have a loss of appetite. And just to add to that a little bit, even if somebody is doing the ketogenic diet correctly, including that fat, one of the quote unquote side effects is the fact that they're going to lose a lot of that hunger. So I can imagine when you're working with somebody that it might be even better to have them on some kind of eating schedule to make sure they're getting enough calories, especially if they're, dealing with cancer and there's a threat there of losing too much weight.
We range from everything, right? Because we have very obese cancer patients and we have very thin cancer patients and we have people with great appetites and zero appetites. And so it really is when we get into that true cancer space, I feel like there's a little more nuance in sometimes, our hunger and satiety signals just don't work properly. Or we're really fighting against, healing. Anybody who's gone through a surgery and has to rebuild and repair, we're in a slightly higher use, right? We need more amino acids. We need more building blocks during times of repair. And while we're going through cancer therapies, that's a constant repair process. We're always trying to heal our normal cells in between each cycle of chemotherapy, in between each dose of radiation. So the more we can do to help support our body during that time. And yes, so sometimes it comes to scheduling. Like, I'm sorry, I know you don't feel like eating and I know you only want to just have this one little drink and you call it a day, but that eating now is your job. This is how we have to do it to kind of pull you out of that hole.
If you enjoyed that clip, Press here for the full episode. I'll see you over there.
This is your body saying, hey, I finally had to throw down this really big, scary word at you so that you would stop and listen, so that you would stop and look. And so now let's just work to see what is